Welcome to this your clinical consultant channel. Welcome to the second topic called Loxoscelism, also called bite spiders of the genus Loxosceles. These spiders are also known as violinists and brown spiders. If you want to know more about this series of poisonous animals, subscribe and give it like the video. Without more to say, let's continue. Spiders of the genus Loxosceles belong to the Sicariidae family, and have different names depending on the region where they are found. It is known as the brown spider in Brazil, the corner spider in Chile, the homicidal spider in Argentina, the fiddler spider, the house spider or zapan in Peru, the brown spider in the USA. They are found throughout America, Africa, Europe, Australia and the islands of the Pacific, and depending on the region there are different species, clinically important. Here we look at the 5 most clinically important genera. First of all we have the Loxosceles reclusa, well known. This spider lives in North America and Central America. Then we have the Loxosceles leda, which lives in Peru, Brazil, Argentina, Uruguay and Ecuador. Then we have the Loxosceles rufipes spider, which lives in Peru and Central America. Then we have the gaucho Loxosceles that lives only in Brazil, and finally we have the intermediate Loxosceles spider that also lives in Brazil. Characteristics of the genus Loxosceles. 1. Its size is between 1/8 to 15 mm, with its legs extended it reaches 30 mm. 2. They are brownish-brown in color and covered with hair. 3. The cephalothorax presents a spot that simulates an inverted violin. That is the name of the violinist spider. 4. They are solitary and predatory spiders, and they play an important role in biological balance. 5. They are not aggressive towards men, they only bite if they feel threatened. 6. They prefer dry and hot places between 23 to 27 degrees Celsius, that's why they look for shoes. 7. They can be found anywhere in your house, even next to you, waiting for you to be new to bite you. 8. Accidents occur mainly at home, when the person sleeps or dresses, and they are more frequent in summer. Poison of the Loxosceles. The venom of Loxosceles spiders has a dermatocrotizing, hemolytic, nephrotoxic and hepatotoxic effect. It is composed of a protein component of molecular weight between 32 kD and 35 kD, which has a necrotoxic and hemolytic action, isolated from Loxosceles leda, Loxosceles gaucho, Loxosceles intermedia and similar to sphingomyelin D from Loxosceles reclusa. To exercise its activity, it needs the inflammatory system of the victim, as a serious complement, leukocytes, proteins, serum amyloids, platelets and endogenous metalloproteinases. In addition to the aforementioned, loxolysins, hyaluronidase, alkaline phosphatase, among other components. Clinical manifestations due to the bite of Loxosceles. There are 2 different clinical syndrome and they are reflected in this picture, the cutaneous and the systemic syndrome. In the skin syndrome, also called dermocrotic, the perception on the part of the patient can be minimal, and even go unnoticed. In the first 6 hours after the bite, burning pain appears, there may be edema, erythema, itching, general malaise and fever. In the first 24 hours, 50% of patients may have a scarlatiform rash. If these symptoms do not appear in the first 48 to 96 hours, the case will be classified as benign, that is, the poison did not do any harm. In the course of 48 hours appear blisters similar to burns of serous or hemorrhagic content. The neighboring skin becomes paled, echimal, with erythematous edges, which gives it a very characteristic marbled appearance. The local lesion evolves into a central red, violet or purple spot. There is incipient necrosis due to microthrombosis, then it turns black for the formation of necrosis at 3 or 4 days. Formation of a face on the 5th and 7th day. This is expensive, It can fall off by the 4th week and reveal an ulcer that will take weeks or months to heal. It is very important to say that the presence of the bacterium Clostridium perfringens in the poisonous apparatus of Loxosceles intermedia can increase the dermocrotic effect and at the same time indicates the use of antibiotics early. On the next slide we will see the evolution of dermocrotic skin syndrome. Well, in the systemic syndrome we have that it is also called visceral or hemolytic cutaneous. It is rare and manifests itself mainly in children. In addition to skin involvement, there is intravascular hemolysis, jaundice, anemia, hemoglobinuria, and kidney failure that can lead to death. Here we can see the evolution of cutaneous Loxoscelism, and we see how the theory is fulfilled to the letter. Treatment against the bite of spiders of the genus Loxosceles, also called violinists. Treatment consists of administering antivenom in the first 36 hours. Daily care of the injury, tetanus prophylaxis, pain relievers and antibiotics if there is infection. And in 2 or 3 weeks a surgical intervention may be necessary to remove the devitalized tissue. Thank you very much for watching the video. I hope you subscribe and like the video. Next video will be Phonutrism bone bites by banana spider. Greetings my dear, until next time.